So, good morning once again. Thank you so much for allowing me this opportunity. And thank you for the special gathering, Chris. Happy birthday. I picked a good day, I guess, to come so I could have cake. I always like cake surprise. Like Nina said, I'm a past student here, a graduate from this program. My name is Melanie Johnson. Now I am doing the online bachelor's degree program at Eastern. So again, I just want to say, let everybody know this is being recorded. If you don't want to be recorded, just let me know and I could not lose that way. So according to the article, and a lot of these notes I got from your text, the Wilkins textbook. The presentation I chose to do is oral care for dementia patient. And I think this is important as dental hygienists. You know, we're going to have all sorts of patients. And like Nina said, we are going to, we did a project where we went to a nursing home and we were introduced to very slight care. We didn't get to do a lot. It was just a screening process, but even what we're going to do here today is a role play, and even just to be introduced to the idea that what to expect when you're going to do care, sometimes it helps. You know, you're not totally blindsided and totally surprised. So the way we're going to do today is we're going to have a little introduction video, and then we're going to read an article to just to get a basic of what is dementia, which Nina said you guys had a field trip or a project or something where you went to observe at some of you already, and if you've ever done anything like CNA or anything like that, you meet a lot of people who have things associated with old age, and dementia is one of them. Alzheimer's or mental neurological loss of function. So it's a common thing that we find. So we're going to do that. Then we're going to go through the information, and we're going to discuss, and then we have a little quiz at the end, no pressure. And finally, then I have an evaluation. If you guys could all fill out for me, that would be very nice. So the information, the course is on oral care for dementia patient. Go to the next one, the objectives, what we want to do today. I'm going to give you this article, and we want to look at it to find the causes and stages of dementia. So at the end of the day, I hope that you'll be able to accurately say what the latest scientific literature is. We should be able to, as a group, be able to list the stages of dementia, recall the knowledge from this lesson. Each student will be able to describe delivery of oral care, treatment of dementia patient at least once, and using another student. This is role play we talk about. We're going to pretend that, you know, there's somebody with neurological dysfunction, and then the other one, we learn different things of how to deal with that. So the first video is here. According to statistics, 1 in 4 persons are going to deal with it. Either you're going to be a person who has dementia, or you're going to be a caregiver for a person. So it's a very high statistics, because, you know, 25% is a big number. So going on now, we want to do the article. 9. Well, they could be yeah, let's split somebody in half, or they could be like a 3.
Call the group of 3.
We're going to take your head and arms, though, because we want to be able to
You guys get the legs in front, so
fun with that.
So we're just going to take a couple minutes. We just want to look to see what the minutes. We just want to look to see what the definition is and what the stages are. Okay. I have your attention again. So, anybody want to share what they read from the pages? What is dementia? How would you define it?
I didn't realize there were so many different types. So it's kind of defined on the type that you have, whether it changes your personality or more of your physiological functioning of your brain.
Good. So, textbook. It's a disease that it has severe mental deterioration. It involves with impairment of mental ability and organic loss of intellectual. The main cause of dementia is Alzheimer's. So that's why in the video we started off talking about Alzheimer's, the person, because it is one of the leading disease that affect people with dementia. You can continue. I'll leave these articles with you. You can look at it later on if you want to really take in more information about that. So, next we go to how dementia is diagnosed. Firstly, it's not sure what causes it. They just know that there are some things that are linked to it. So some of the theories include some people are more genetically predisposed to it. Sometimes it's your environment. Different things can trigger certain genes to turn on or turn off. And so later on in life, you see that. And this is, at first it was thought to be associated with mainly old age, but now people are getting dementia at a younger and younger age. In the general practice office where I work, I saw a person that was 58, and he looked like a big, healthy, strong person, and I didn't understand why his wife brought him to the appointment. And after reading the notes, I learned that he has early stage dementia, and already he was not, to me it seemed like it was mild. In the chart it says early stage, but he seemed to already be advanced because he's not remembering things, and you keep have to remind him why he's at the appointment, and he's not yet 60. That was shocking to me. And one of the main reasons why I thought to do this on dementia is because I want to learn about it for myself. I want to see if it is something, whatever I can do about it, I want to do about it to affect myself. In fact, I plan to research more and see all the preventive methods, because a lot of things about it is only prevention. There is no good treatment. So another cause that is assumed is free radical infectious agent. That's what I was talking about. Some things turn off some genes. And it's even thought that flossing more, there is an association. I had a video with a news report that was talking about this. It seemed like if you take good oral care, or if you have good oral care from early in life, there is a link in the number of people who have dementia and floss. So another good reason to floss every day. You could tell all your patients that, because I don't know why people hate flossing so much. So going on to the types of dementia now, we have Alzheimer's, which we already talked about, dementia with Lewy bodies. This is the more information about this is on the handout also. Vascular dementia, that's when it has to do with some parts of the blood and blockage in the blood system. Most people are familiar with Parkinson's disease, I imagine, right? It's another, because it's a neurological disease, so later on, people would show up with dementia at a certain stage of Parkinson. Frontotemporal dementia, and mixed dementia, which it can be caused by different things, a combination. So how dementia is diagnosed? There is not a set test, that one thing like they test and they see if you have a virus and you have a flu and they know what it is. So doctors do a number of different things. They observe the person. It's a lot of times from report from family or friends, like, oh, he used to do this, but he doesn't do that, or he does this and this, and I wonder why. So there is a physical exam to see the things that they can do. There is the neurological exam, the mental status. They ask the person questions, see what they could answer and how it works out. Some laboratory tests, one of it is called a mini mind, and I don't know exactly what all they test for, but it's a small version of like a CAT scan, and they look in certain parts of the brain and depend on how it is. So, and a lot of times the testing for dementia is ruling out other diseases. So if they do certain tests and then they're able to do this, or they're able to see something, then they say, well, it's not that, and then finally, by process of elimination, it would come down to dementia. That's interesting, I thought. The progression of dementia. So, like I mentioned before, there's mild, moderate, and severe. It's interesting to me that going through the stages, according to the Wilkin textbook, some people can be diagnosed with the dementia when they have normal function through these tests. So even though you're not showing signs as yet, this is why some of it is thought to be linked to genes, because they could already see certain things, and so you have to learn ways to get them to do things easily. Stage 6, severe dementia. They have worse memory problems and they cannot recall. So I just want to take a minute to check to see anybody have any questions, anything inspire you. Yes.
I just got a little
Great.
because I have mild dementia. So when the early flossing, that's a preventative thing, or they saw a link between
The
onset of it and the zealous early flossing?
early flossing is a preventive, because
Okay.
the same things that we want to remove when we floss, they detected that the people with dementia had more of it on certain parts of their brain. So by removing it from the body, it prevents it getting to the brain.
And when they say early, so they're saying basically,
Well, people with good, they have access to care from early in age. You know, they go to the dentist every 6 months like they're supposed to, like from teenager up. They didn't specify for younger than that, but they say like as adult. That's why I said teenagers, early adults. You have to start getting good care and all the things that prevent oral disease, you know, help to prevent other things. And this is not the only link that we see to dementia and oral care. It's just coming around now. Any other questions? Okay, so we're going to do a little test at this checkpoint. If a few of you could just give me a one sentence summary of what we just went over. Just quickly.
The stages of dementia.
Yes.
Subject, you need a verb.
Yeah, that is a one sentence summary. Okay, how about
Incomplete sentence.
how about something that stood out to you in the presentation so far?
Just with all of our advances in science and how much we've learned about the body, how little we know about a disease that it affects a vast majority of the population and how it's continuing to affect it at earlier and earlier ages.
Yes. Yeah, it is always interesting to me when these new studies come out with stuff that seems so basic, but they affect so profoundly. On to our other section. So, like you said, providing care becomes imperative in preventing dementia, or at least slowing down the advancement. Like I said, different people will go through it at different pace. So we want to do what we can. And a lot of times, like I said, of the 25% of people that are affected, either you could be helping to care for the person, or you could help give information. You could educate the caregiver of these people and spreading the word to their relatives or friends to do good care as early as you can, and it can slow the progression possible. Like, it's not conclusive at this point, because they figure once a person have dementia now, it is going to be there, but it doesn't have to advance as quickly as with others. Some of the things that we do in providing care, when you see the person, they may misinterpret your action. The dementia patient, remember, they say they can't figure sometimes what is going on. So it is good to say what you're doing verbally, move kind of slowly towards them. You don't want any sudden movement and anything that looks like attacking them. You want to let them know you come in peace, so they don't have to worry. So you talk with them even before you start giving care. What's your name? How do you feel today? A lot of times they will have, all the cases that I've seen, they have somebody with them. So you say, who is this? And we talk to the person and let them know we're all friendly here. And they allow you to do more likely to do more if they perceive a friendly action. So it says often it is more important than your verbal communication. That is to establish a good relationship with them. Even in the few minutes that you have, let them know that you're friendly. You smile, you touch their hand if they're inclined to that, because human contact a lot of times will let us know whether a person is friendly towards us or not. So you use all your good communication skills that you have and to emphasize your friendliness. Special considerations. The goal of the dental hygienist is to provide care in the most comfortable way you can. So you don't want to have to like wrestle them, to clean their teeth or whatever. So you talking to them will help move them along in this direction. It is very important to keep care continuous when you're dealing with dementia patients. So you want to encourage the caregiver to set up future appointments and keep consistent. When the patient is there, I mentioned about how you move slowly towards them. You don't want them to be suspective of your behavior. You refer to patients, physicians. So if you're talking about the caregiver, if you're talking about somebody related, make sure you use names to be clear on, because if you say he or she, the person, either the caregiver or the patient may not know, they get confused and misunderstanding happens. So, as a hygienist, we always have to review medical history. So we should be able to see and know where the person is in their dementia stage, and make notes or take interest in the notes, how fast it's progressing. Is it a person that seems to be going down fast, then you know how to advise the caregiver. The suggested interval, and this is for most patients with special needs, is 3 months interval. I have seen at a clinic where I went to, there was a lady that was there every other month, 2 months. So if patients are open to that, I think it's good also, because a lot of times at home, the caregivers are not able to do certain things, so then there's more build up, more to see to when they do come into the office. So if they're open to coming every other month, I think that is good. The recommendation is at least, or at longest, a 3-month interval. When it's a late stage dementia patient, the routine oral examination, you have to also check for lesions. This, I think, after it gets to severe stage, would be out of our jurisdiction as hygienists, because if you have to sedate a person, they probably in the hospital, or they could go for one-day care. There are some surgeons, and I know in like for extraction, certain extraction, they would sedate. So it depends on if it's a person that, I don't think this would be in a general practice office. So a possible need for a mouth prop, which is a good thing even in earlier stage, because then they forget, like you said, forget why they're there. And I've had quite a few people close down, and it's very scary. You're like, are you okay? I haven't really stabbed anybody with an instrument so far, so it's all good, I think. But it sure scares you when they close down on the instrument, and you know it's sharp and all soft tissues in there, mostly soft tissue. So if that keeps happening, you could use a mouth prop. If it's a patient that resides in a long-term facility, usually they would have the caregiver there, and you'll have assistants like nurses or other people who work there. So then ask for people to help you if they're available. A lot of times, if you end up seeing a lot of these patients, it's because you're in a specialized field. So then as you do more, you learn more, right? So that'll help prepare you for other things. So there is a couple of videos here. One is going to talk about this one clinic that they prepare other people to deal with people with dementia, which I think it was a good undertaking, because it's nice to know where you can go to get more information. I'm just going to copy and paste that there, and then after this one we could do the group activity.
Now we're heading to Allegheny County, where one dental office is trying a new approach.
Okay, so now, anyone have any question? Yes.
So it says making the waiting area non-threatening. I'm really curious about that, because it's like we don't put snakes or anything in those.
Well,
You do. Got it.
Like the other video said, though, the dentist making the waiting area non-threatening might be include removing red
Well, sure, okay, yeah.
I was surprised when researching this. It's
Yeah, that
just
was
different
interesting.
colors trigger. So we have to find out more things that they fear or that elicit alarm, and then you remove within reasonable. And I imagine for offices that see more dementia patients, they might do more. If you only see one now and then, I wouldn't imagine you do a lot. So it depends on the level.
What do you think about, do you think it would violate HIPAA if the patient was able to consent putting up pictures of you together where they look happy? So even if they start to feel a little insecure, they see themselves like, oh, I've been here before, I was happy, I know this person.
That's a good idea. As far as the HIPAA laws, we need to get consent from the person. So I would imagine that would cover their caregiver if the person is not cognizant enough to sign. So with authorization, with the proper authorization, that's a good idea, I think. Any other? They are, and sometimes they may be self-sufficient in eating and caring for themselves. You just have to keep reminding them. One of my earlier jobs that I had, I cared for one person while the wife went to Bolivia for a few months, and I kept having to remind him, it's time to shower. So even though he could do it for himself, not aware of which day it is, what time of the day, it's time to go to bed, I had to tell him. It's time to eat. Because he would just sit there, he talks and he tells me stories and it's very entertaining to listen to. But I constantly had to remind him, time to eat, time to brush your teeth and do this. And he loved going to church. So I would tell him, go shower and then we'll put on a nice suit and we'll go to church, even though if it's not a church day. So you have to learn ways to get them to do things easily. Stage 6, severe dementia. They have worse memory problems and they cannot recall even long-term or recent experiences. Something big.
I know. What's this?
I think I'm not so on time on my phone. The trouble remembering the names of others and change in sleep patterns, so it starts affecting them in where they're not able to sleep as much as they used to, or they sleep more. Some people, I think it's more likely that they sleep a lot longer than they used to, and then you have to wake them up and it gets more difficult to care for them at that point. Needs assistance with toileting, and in this stage they're suspicious, because imagine if you don't know what's going on, you're always wondering, who is this person? You don't remember their name. What are they going to do? You know, is it a friend or is it somebody that is here to make me do something I don't want to do? So they're suspicious of almost everybody. It's good to just talk with them and feel out, see how they are from day to day. Very severe dementia is a loss of ability to respond to environment. They cannot carry a conversation anymore. And it's easy, or they cannot easily control their movement. So they don't talk continuously anymore, and they may have a difficulty getting up, sitting down, because it's the neurological function. They're losing the ability to control different parts. They may have toilet issues, and even with expression, like smiling, like so they're not talking, they don't know when to smile, or they can't control when they smile, or if they feel like smiling, they don't show it. And holding their head upright and swallowing. So this progresses to a severe form where they need total care. So I just want to take a minute to check to see anybody have any questions, anything inspire you. Yes.
I just got a little
Great.
because I have my dementia. So when the early flossing, that's a preventative thing, or they saw a link between
The
onset of it and the zealous early flossing?
early flossing is a preventive because
Okay.
the same things that we want to remove when we floss, they detected that the people with dementia had more of it on certain parts of their brain. So by removing it from the body, it prevents it getting to the brain.
And when they say early, so they're saying basically,
Well, people with good, well, they have access to care from early in age. You know, they go to the dentist every 6 months like they're supposed to, like from teenager up. They didn't specify for younger than that, but they say like as adult. That's why I said teenagers, early adults, you have to start getting good care and all the things that prevent oral disease, you know, help to prevent other things. And this is not the only link that we see to dementia and oral care. It's just coming around now. Any other question? Okay, on to our other section. So like we said, providing care becomes imperative in preventing dementia or some of the things that we do in providing care. When you see the person, they may misinterpret your action. The dementia patient, remember, they say they can't figure sometimes what is going on. So it is good to say what you're doing verbally, move kind of slowly towards them. You don't want any sudden movement and anything that looks like attacking them. You know, you want to let them know you come in peace, so they don't have to worry. So you talk with them even before you start giving care. What's your name? How? Special considerations. The goal of the dental hygienist is to provide care in the most comfortable way you can. So you don't want to have to like wrestle them, you know, to clean their teeth or whatever. So you talking to them will help to move them along in this direction. It is very important to keep care continuous when you're dealing with dementia patients. So you want to encourage the caregiver to set up future appointments and keep consistent. Okay, so now we want to do a role play. I'm excited about role play. You guys did a lot of role play. I remember we did some practices here. So coming to the part where where we went to do our community project. I think that's the next slide. So you see how the lady in the picture there, she's just looking at me. No smile or just like questioning. And a lot of them were like that. And what they did, the first thing is to open their mouth. If we're going to do oral care, we need to open their mouth. And they would look at you and not open. So the hygienist that was there, her name is Allison. I don't know if you met her. Maybe some of you.
Yeah,
She
Allison is actually speaking tonight at the component meeting, so if any of you want to go see her, she does senior care, and she's awesome.
Yes, she is very good to work with. So she helped us along in figuring how to get these patients to do anything. So what you want to do is to use maybe the mouth mirror or a toothbrush or something clean and not sharp. And you put it close to their mouth and you want to kind of gently see if they're going to open up. You talk to them while you're doing it. And while you're talking, if they are not too conscious of something in their mouth, they may open, and then you have to be able to carry a conversation with them and do whatever it is you're trying to do. For us, when we were doing the project, we were doing a screening. So we would have our sheet close by, and while we're talking to them, how are you then? What did you do? How is this? And if they're opening up, then you look at the paper, that's a yes, that's a no, and we just check in, and then at the end, we, you know, quickly take off gloves, and then we write what we wanted to write down, and ask the caregiver other questions or whatever we didn't find answers for. So it's just things like that we want to practice today. Did we have the toothbrushes and gloves?
Bunch of stuff back here.
Okay, bunch of stuff is good.
How's your project?
Here you go. How many
If you're really lucky, you'll get the wheelchair set too. So fast like I get at work.
Oh yeah. So what we want to demonstrate here is if you're finding a person with resistance, okay, how you talk calmly to them, you move slowly, and as soon as they let you, you get in there and you do what you're able to. So, hi Nina, how are you today? Are you good? What did you do? Anything fun? Is there somebody with you?
I don't know. Maybe.
Okay. Well, I guess she's not aware of her environment. She can't answer any question, definitely. Well, my name is Melanie. I'm the dental hygienist, and I want to just look in your mouth and maybe brush a little bit today. Is that going to be okay? Sure. Have whatever you have, you're going to. Oh, that is good. Thank you. Yeah. I see I can get a little bit in here. Thank you. Oh, that might hurt your teeth. Don't bite on that. Let me take it out a minute. So, if sometimes you have to take a couple of tries to get what you want done. Let's try this again. Okay, don't bite on the toothbrushes. It might hurt your teeth, okay? I just want to look in there. Okay. So then you can get something, pull the cheek aside. Of course, I would have a mouth mirror or something else. So then you could work on that side. Try and move the lip whenever you can. And stay away from in between the teeth because they do bite down all the time. And you keep on to say, that might hurt. Don't bite on that. So as soon as you can get in the mouth, you can go towards the side. And this is where you would, if you did. We have a very good actor here. So, the easiest thing, you have to see what you have advantage. If they're opening wide, you get in there and do the inside. If they're not opening wide, then you do the edges. Okay? And then you look around. Like I said, you have to be talking. Oh, I like today. It's not raining at all. Did you like all that snow we got last week? And then you make a good assessment. You do what you can quickly, and you say, "Go, thank you."
Thank you.
I am glad you could come today. Yes, you can go. Thank you so much.
Hi now.
It's good practice for when you get dementia.
My cat has Parkinson's, so I'm guessing.
Oh, I know. I will be there too.
I'm basically.
Cat has Parkinson's.
Hi, Adrian. I don't know if you remember me. My name's Irene. We're gonna look into your mouth today. How are you doing today? Okay. Did you have a nice morning?
I don't know, what time is it?
It is 11:25.
At night?
No, we're still in the morning.
Oh, well.
We're going to try and take a
Well,
look
you
at
asked
your
me if I
teeth.
had a nice morning.
Yeah,
It is morning, though.
it is morning. Did you have breakfast?
I can't remember.
No. We're going to get started
I'm hungry.
today. You're hungry? How about
Do you
if
have a tuna sandwich?
I'll tell you what, if you can open your mouth for me, I'll make you a tuna sandwich. Do you like mayonnaise? I know, I remember you said that. So I'm putting these gloves on,
Okay.
just because I want to be clean. I'm going to be looking in your mouth, okay?
Okay.
And I'm also going to put this mask on
Oh,
because I had a lot of coffee.
where did Irene go? Oh.
Alright, so here's a toothbrush. And I'm going to put this in your mouth and kind of brush a little bit.
Okay.
It's really soft. Do you want to feel it? It's not going to hurt you. Okay? Go ahead and open up your mouth. Oh, wow. You're good. You are strong. So what I'm going to do is just try and put this in your mouth and brush a little bit.
Oh.
Do you want to try it? Why don't you do it for me?
Okay. What do I have to do?
Try and brush. Entry level here. Hey, that's great. Look at that.
Yeah, that's a good way to take advantage
Gonna
of.
get him a brush. Look at that. That's great. Good job. Have you been brushing at home? I can tell.
You can't tell. I don't know if you want to tell him. Okay, that's good. Thank you. Thank you, guys. So, anyone have any other questions? You want a good recall for, like I said, most special needs patient is a 3-month recall. And it's good if you find somebody that will do it every other month. The last question for the quiz is just a summary. It says, what is your thought about the topic with oral care and dementia? Any of you think you want to learn more about it, or you think this had been helpful as an introduction, or whatever thought you could spit it out now. AJ.
I really want to know why people with dementia react to red like a fighting bull.
That's a good thing. I'd have to research it myself. Red is a very
That's one thing
threatening.
I'm most curious about it.
I think red is a threatening color overall, though. It just seemed to be, and we could research what other things may seem threatening to them too. I think you brought that up earlier, so that's good. Any other comment about?
I mean, this was just a really good introduction to the topic, and kind of gets us, started with knowing how to deal with patients with dementia when it's such a common
Yes.
disease.
Yes. Thank you.
Very beneficial.
Good. Anything else? Okay, so now I'll give you an evaluation. Yes, so yeah, I'm going to email the other one to Nina. She can fill it out and email it back to me. So thank you all so much for being here, for listening, for participating, and for doing the evaluation. And you guys are a good bunch, I think. You're not, it's hard when you're talking to somebody and they're just sitting there. Yeah, so you smile, you nod, you acknowledge, so that is good. Thank you.